Santanu Ghosh, who is a doctor at Tripura Medical College, will be talking in mental health, and his title of the talk will be Job Stress Management. Dr. Ghosh passed MBBS in 2005 from Guwahati Medical College, Guwahati, passed MD in Psychiatry in 2011 from Assam Medical College, Dibrugarh, Assam, awarded PhD in 2020 in Psychology from Tripura University, working as Associate Professor Psychiatry at Tripura Medical College, and worked as Operational Trainer in Tripura for National Drug Use Survey in collaboration with AIMS, New Delhi, and Ministry of Social Justice and Empowerment, Government of India. There are total 14 publications so far in national and international journals in the field of addiction and general psychiatry. Presently doing fellowship in JSS Medical College, Mysore in psychosexual medicine. I welcome you, sir. This is the second time we are having you in a row. So I welcome you. Please take over the session.
Thank you for nice words, and good morning, everybody. I am being privileged to Department of Physics, Tripura University, that whenever there is a issue or there is a talk or there is an academics on mental health, Arshad sir thinks about me. That's why I'm being privileged. So without spending time, I'm just switching over to my topic, and let me share my screen. I'm getting difficult in sharing.
Sir, unmute yourself.
So at the bottom panel, there is an upward arrow close to the hand sign. You can click on that, present now.
Is my slides visible?
Yeah.
Every time I face technical problem and I have to call my daughter.
Oh, that's fine. Sir, your screen is visible, but your slides are not yet.
Is now visible?
No, not yet, sir. Your screen was visible.
Okay. I think there is a problem.
Now you select your entire screen.
Yes.
Under the present tab.
I think it's now visible. Is it
Yeah.
visible?
Yeah, it's perfect. So make it full screen.
Yeah. So my today's topic is job stress management. As all of us here in this forum, almost all of us are working somewhere, probably in the academics. Every job is being associated with lot many stresses. So as a part of mental health issue, I'll try to discuss on this aspect of mental health. In my entire session, I'll have divided the topic into three parts. First is general awareness. Now, what is general awareness? Basic things regarding stress. What is stress? How it is being manifested? What are its qualities? Next, stress at work. That means the points or issues or the domains in the work atmosphere where from stress is being originated. And lastly, the main thing is how to help yourself. That means the job stress management. Coming to general awareness, that means few lines on the basic aspect of stress. Everywhere, every now and then we talk about stress. I'll try to outline what stress is, then types of stresses, the individual factors associated with stress, how the stress is being originated, and how the body reacts to this. Next, how our body gets adapted to this stress, the symptom associated, and few more topics. So what is stress? As a psychiatrist, and when I'll be dealing with a mental health aspect, so quite naturally I'll say the emotional and the behavioral aspect of anything, and these things applies to stress also. Now the book definition or the bookish definition of stress is the mental, physical and emotional reaction one experiences as a result of
Sir.
demands of one's life.
Sir, your slide is not moving, I guess. You are in still first slide? Oh,
No,
now
sir.
it's moving. Now it's moving.
It's moving. I
Yeah.
think there is bandwidth problem.
Okay, maybe, no problem. So now what is stress? Okay, so please
Yes.
go on.
Yes. This is one of my favorite slide while I speak on stress. Lot many definitions were being given by different authorities, different bodies, but the most accepted definition was given by Sir Richard S. Lazarus. He said, stress is a condition or feeling experienced when a person perceives that demand exceeds the personal and the social resources the individual is able to mobilize. Let me simplify that. Suppose we are faculties, my organization demands that in the next NAC assessment, my institute should get A or A plus. Now I know that my capability, my resource and my all amenities are not up to the level of A or A plus. So my demand is I should get A or A plus, and at the same time my capability is B. So the extra amount of pressure will be manifested as stress. So when the expectations are more, when the demand is more, and which is out proportion to that of my ability, then the emotional and the behavioral problems which comes, which is manifested as stress. In other way, what is stress? The process by which we perceive and respond to certain events called stressors. Now, what may be the stressors? That means the triggering factors. Suppose any life events or any disharmony in the family or any day-to-day life course. Suppose I had to enter into this webinar by 10:20 or 10:25. At the initial phase, the net was not correctly working. So as I was delayed in entering into the webinar session, so I was a little worried. So the anxiety or the distress which came into my mind, that is giving the stress, and here is the stressor is the technical issues. Then we lot many intervening factors. Suppose few factors will be the precipitating factors, few factors will be my power or my relieving factors. Suppose in my organization I am being apprised, or I am being my authorities, my boss, my seniors always appreciates me that yes, you have got this many publications, oh you have got this many projects, oh this year my students has got this percentage, or the placement is so nice. So every time I get appraisal from my senior colleagues, so that is my power, or that will prevent me for exposing to stresses. Then passive control. For a given type of stimulus, suppose I am appearing one exam. Practically also I am appearing an exam from next 25. So all the candidates or all the examinee are exposed to similar stress, similar event. Somebody will manifest the stress and somebody won't manifest. Now why it happens? We have to remember one sentence, one thing. When we perceive the stimulus as to be a stressor, then only stress can manifest. If we do not consider it to be a stress, then stress we won't be exposed to, or we won't have manifestation of stress. Personality. Suppose anxiety prone person who are vulnerable to get stress or exposed to stress. Social support. Suppose good family environment, good marital harmony, these are the supports when to avoid the ill effects of stress. Next, the coping behavior. Wherever, however, in which any form, if a stress comes, in any way I am able to handle the situation. That is my coping behavior. So more the coping, more less will be the ill effect of stress. Now how the stress is being manifested? There may be physiological reaction. Now what is physiology? I'll come into this topic in my later slides. Then maybe emotional reaction, then maybe behavioral aspect. I'll later on I'll come in my I'll discuss this in my later slides. In other ways, stress is a reaction people have to excessive pressure or other types of demand placed upon them. It arises when they worry that they can't cope. Just try to remember, stress occurs when pressure is greater than resource. S is equal to P more than R, where S stands for stress, P stands for pressure, and R stands for resource. Now how we feel, or how we could how we come to know that stress is occurring or stress is having effect on me. First thing is I'll be worried, undue worriness, or I'll be tensed, I'll be fatigued, or I'll be tired, and very trivial stimulus I'll be frightened. And many times it happens that there will be expression of depression, low mood, hopelessness, worthlessness. There may be anxiety, undue expression of anger. With a little or with a trivial cause, I lose my emotion. So what are the different types of stressors? There may be external stressor or internal stressor. Now what constitutes the external stressors? Suppose first in the physical environment. Suppose even in the autumn period, the humidity of Agartala is high. We are profusely sweating, or the temperature is too high, or the electricity, there is no electricity, or the load shedding is going on. So what will happen? This will have an impact, it will have an ill effect on the physical environment, and which may be a cause of stressor. Social interaction. Suppose I am aloof. Suppose I cannot mingle with my peer groups, my colleagues, my family members. So if I am having poor social interaction, probably when I'll lose all my resilience, then it may it may manifest as a stressor. Organizational. Just now I have given example that my organization demands me this much activity. Practically, I am not able to give that output. So that is a stressor. Major life events. Suppose your near and dear one passes away, or a new baby has come into your life. So these are some major life events. Suppose you met an life-threatening accident. So these are some major life events which may act as a external stressor. Daily hustle. Suppose you have to reach your department by 9, and you have to change the vehicle, or you have to alter your way of transport thrice in the whole transport, in the whole distance. So this may be a stressor. These daily hustles, if it is not being fulfilled or if it is not being done properly, this may be a cause of external stressors. What are the physical environment? Just now I have explained: noise, bright light, heat, one small room. In that case, the person may become claustrophobic. Social interaction, like rudeness with your family members, with your peer groups, with your colleague, aggressiveness by others, bullying. It's a very common phenomenon in every organization. Your senior always bullies. So after certain time, this may be a stressor, external stressors. Organizational factors like rules, regulation, deadline, output, appraisal, all these things can as a external stressor. Few examples of major life events like birth, death, you have lost job or promotion. This may be a positive thing, even though these are stressor. Earlier, few days back, you were unmarried. Now today you are married, so you are being exposed to different dimensions of life. This may be an external stressors for you. Daily hassles like committing misplaced keys, mechanical breakdown, your AC is not working or your fan is not working, your daily household activities is not being done properly. So this may be an factor for external stressors. Coming to internal stressors: lifestyle choices, negative self-talk. I'll explain these things. Mind trap, personality trait. Each and everything I will explain. Suppose lifestyle choices. Whenever I'm in trouble or whenever I'm in distress, I go on continuously taking coffee or tea. I'm having sleeplessness. I work up to 12 at night or 1 a.m. at night. So these things are poor lifestyle, and due to this poor lifestyle, we may be exposed to ill effects of stress. Now, self-criticism. That means
Dr.
what?
Ghosh,
Yes, is my slides visible?
it is number slide 5. Right now you are
No,
at
sir.
5.
No, sir. I've moved a lot. I couldn't understand why this is happening.
Uh, Now you may unshare your slides. Please share again.
Is it visible now?
Yes, it is visible. Now it is.
Is it possible for poor bandwidth?
Maybe you, in that case, you can do one thing. You can mute your video.
Okay. In that case, I will switch off my video. Okay.
So right now it is in mind traps.
Yeah.
Is that the same at your end?
Yes, yes, yes.
Okay. Now it's, just move at a little bit.
Is it changing?
No.
Changing?
No.
couldn't understand why it's happening. Hello.
Yeah. Share again, sir. Yeah, your screen is visible. Presentation is visible. Try to change it.
Is it moving?
No, not yet.
I'm moving, but it's not moving.
No. Right now it is moving. Types of stress.
Yes.
Yeah. Now it is in mind traps.
Yes. Is it personality trait?
Not yet.
If I give a full slide share, then probably it is not moving. Is it moving?
Yes, it is moving. Then keep it in that way.
Okay. Okay. Now let me maximize the slide. Is it visible now?
Now it is visible. Negative self-talk. Negative self-talk.
Okay, sorry for technical glitch, and even though there is problem, I'll try to explain. I
Yeah,
hope
no
that my slides are visible now.
Yeah, it is absolutely visible. Please
Now,
go on.
negative self-talk, like self-criticism, always pessimistic thinking. Whatever I am doing, it's not at all perfect, or I am not liable to do particular this task, or whatever responsibility is being given by my organization, I am not fit for that. So this type of negative self-criticism always puts us or puts a person to stress. Over analyzing a very simple thing, very simple topic, which is very much easily handled, and everybody is exposed to such type of situation, and you are not, because your over analysis, you are always considering pros and cons and other aspects. Hello, is there any problem, sir? Any problem? Hello.
Dr. Ghosh, you carry on.
Okay. Next, mind trap. Now we are being trapped in our thought process. Suppose unrealistic expectation. I am being a student. My capability is that I'll pass. I'll get 30% marks, but my wish is to get 80%. So if it is a 30% student per student who will be scoring, who will be getting 30%, if he desires to get 80%, and at the same time his performance and his preparation and his attitude is not up to that mark, and he is always having this unrealistic expectation, and every time he goes on thinking that thing, this he will be put into this trap, taking things personally. Sometimes our failures or our achievement is being shared among the group members, or among the, suppose as we are teacher, among the faculties. So every criticism, if we take personally, then it may be a stressor for us. All or nothing thinking means I have to do it completely by myself. If I am not able to do it, nobody can do this. So this type of thinking or attitude will put ourselves to in problem. Exaggeration, that means a trivial thing, I am exaggerating, I am being I'm hastening these things. Rigid thing, if I am rigid, suppose for a given condition or a given situation or given task, lot many opinions may be there. Now if I am rigid to my opinion, and I won't listen to some my colleagues' opinion, then I'll be exposed to stressors. Personality trait. Those persons who are obsessed, that means they are perfectionist. They always tries to do very meticulously. Now in doing so, they are taking more and more time. At the same time, after finishing the task nicely also, they are not being satisfied. So dissatisfaction will result into stress. Workaholics. We have seen many of our friends and colleagues, they're working late in the night, jeopardizing or the compromising the family life. So these things will bring pressure or stress in them. Now, types of stress. Few stressors are negative stress and few stressors are positive stress. So in other words, these are eustress and distress. Eustress means positive stress. Now what means what I mean by positive stress, I'll explain. Coming to negative stress, it is a contributory factor in minor conditions such as headache, digestive problem, skin complaint, sleep difficulties, ulcer. These are a few small trivial health issues which is giving us stress. Sir, my voice is audible to you?
Yes, absolutely. It is crystal clear.
Now, positive stress. Suppose you get promotion, or you're, from associate to become professor. So you are being given a lot many responsibilities. So whenever you are exposed to a new situation, although these things are very much good for you, even though you are stressed. So for work activity or for performance, little bit of stress is needed. That's why these are called positive stress or eustress. I myself as an individual and in the society or in the community or in the organization, every individual is different from one person to other. It's their personal trait how they handle the situation and how they react to the situation, whether it's suitable for them or not suitable or not. These things depends on their personality trait. Coming to endocrine system, what do you mean by endocrine? The hormonal system which is being present inside our body and how our body reacts to stress. If we try to understand this problem, we need to know how the body functions through different hormones in our body. Let me take example of this slide. Is this slide visible? Sir, is this slide visible?
Yes.
Suppose we are being exposed to stress. You can see the cursor. We are exposed to stress. How our hypothalamus is a part in our brain. It is being now depression, depressive mood, sleep difficulty, decreased pleasure, appetite, decreased sexual drive will act on this hypothalamus. Now in turn, hypothalamus this hypothalamus will release corticotropin releasing hormone. That means here is corticotropin releasing hormone. It will be released from hypothalamus and it will act on anterior pituitary. As you are all, I think all of you are from physics. So please go back to your high school days where you are being taught these parts of your brain. So the pituitary gland, basically it is having two parts, anterior and the posterior. This corticotropin releasing hormone, when it will act on the anterior pituitary, then it will release adrenocorticotropic hormone, ACTH. When this adrenocorticotropic hormone will act on the adrenal gland, where this adrenal gland is situated, it is situated just above the kidney. It is also called suprarenal gland. Supra means above, renal means kidney. This adrenal gland, it has again two parts. The outer part is the cortex and the inner part is called the medulla. The Cortex releases cortisol. Cortisol is nothing but steroids. Now, when more and more steroid will be released in our body's defense mechanism will go down, and we will be exposed to different infections in our body. That means our immune system will act poorly, and there may be secretion of tumor necrosis factor alpha, TNF alpha. These are some, these are some inflammatory markers. You might be knowing interleukin 1, interleukin 6 in this COVID era. When the patient is having some, poor score in CT scan of lung, we used to advise this IL-1 and IL-6. These are some inflammatory marker which is present in case of corona patient, and which is being released from the lung. So the cortisol, that means the corticosteroid, will release these immune marker, inflammatory markers, and thereby causing the disease. And when this adrenal acetate will act on the medulla, that is inner part of the adrenal gland, it will release catecholamine. Catecholamine means there are two types of catecholamine. One is called epinephrine and another is norepinephrine. When this epinephrine, norepinephrine acts on the heart, there is, the pressure, the systolic pressure goes up. There is palpitation. There is perspiration or sweating. So this catecholamine, when it will act in more and more, that is, if the activity of this catecholamine will significantly increase, it might cause MI, that is myocardial infarction. Ventricular arrhythmia. Ventricular means it's a part of the heart where the rhythm is alters. If it acts on the blood vessel, the wall of the blood vessel, if it acts on this wall of the blood vessel, the platelet is again, it's a blood cell. The activity of platelet goes down, and there may be vasoconstriction. That means the area of cross-section of blood vessel goes down. If the area of cross-section goes down, what happens? The pressure increases. If the pressure increases, then patient might land up with stroke and other form of cerebrovascular accidents. So all these things, this mechanism goes inside our brain or inside our body without having knowledge of that. And these are the hormones which are, or these are the chemicals which are responsible for manifestations of the physical and emotional expression of stress. Now, how our body responds to this? That is the general adaptation syndrome. First is alarm response, adaptation, and exhaustion. I'll explain these things. Suppose you are in the market, we are in the market, and suddenly we have seen a snake. So what will happen? Either we will fight, or we will kill the snake, or we will flight. That means we will go away, we will run away from that situation. So these things depends on the assessment of our brain. Now, how our brain assesses these things, depending on our previous knowledge, on previous experience, our brain assess the situation, and according to the assessment, we take the decision that whether we'll kill the snake or we'll fight from that situation or from that place. So these things is being done through these neurotransmitters or these hormones. The endocrine system comes into play. Adaptation phase, when you are being exposed to such type of stressor for longer duration of time, our body brings some changes which is needed at that point. And when this adaptation or when this this defense mechanism breaks down, then the manifestation of stress comes into play. And when chronically for longer duration of time we are being exposed to such stressors, and at the end we get exhausted and exhaustion comes into play. Now, coming to the symptoms of stress, as I have divided these things: physical domain, mental domain, behavioral, and let me explain this. In the physical symptoms, like there may be sleep problem, there may be fatigability, indigestion, lack of sexual drive, headache, body aches, pains, infection. Why infection occurs? Because when you are exposed to stressors chronically, your body immune mechanism goes down, and due to the presence of catecholamine, just few minutes back I explained. So you are being exposed. Sir, my slides are visible? Hello?
So right now it is showing 30.
Physical symptoms.
Yeah, physical symptoms. Right now it
Okay.
is.
Now, if we move to full screen, then is it visible?
No.
Oh, so then let me exit then.
Sir, it is okay right now. You can carry on in that way.
Okay. Then giddiness, there may be loss of consciousness, sweating, perspiration, tremulousness of hand, breathlessness, palpitation. All these things are physical symptoms of stress. Now, what are the emotional or the mental symptoms? Poor concentration, poor memory, indecisiveness. You are having difficulty in taking decision, confusion, disorientation. Disorientation means you are not at all oriented to time, place, person. There may be feeling that as if in the very next moment you will die. That is the panic symptom. What may be the behavioral symptoms? Appetite change. There may be excessive eating or voracious eating, or absolute there may be no eating. Increase intake of alcohol or other drugs, suppose cigarette smoking. Restlessness, nail biting. Hypochondria means something odd has happened in my body, or my heart is not working, or my liver is not working, or my stomach is not. This type of feeling, in spite of every result are normal, we are thinking that this particular organ is not working inside my body. What may be the emotional symptoms? Like bouts of depression, impatience, fits and rages, tearfulness without any reason. I am weeping. Disorientation of personal hygiene and appearance. How I am looking, how I am being dressed. I am putting least interested on that. Stress and related illness. If a person is exposed to stress chronically, he lands up in cardiovascular disease, immune system disease, asthma, diabetes, digestive disorder, ulcers. Then around periods in female, many a time we have seen that the lady is exposed to premenstrual dysphoric syndrome, headaches and migraines, depression. These are some features, these are some problems we often exposed to. We manifest these problems when you are exposed to stress. This with this I have come to the end of part 1. That means the basic aspect of stress. I want to ask you, the listener, my audience, do you have any queries till up to this point? The basics of stress, because you will be answering few questions. If you have got queries, you can ask me. I'll be very happy to answer your queries.
Participants, if you have any questions, you can directly unmute yourself and you can ask to doctor.
If there is no problem, I'm moving to the part 2. That is,
yes, you go on.
Stress at work. Under this heading, what I will discuss: how do we work, factor influencing work stress, work pattern, situation, and if time permits, I will discuss few cases also. Now, why do you work? For our livelihood, to earn our livelihood, or for our growth or betterment, we do work. Now, many times we have seen that the way we are performing our work, possibly they are not at all the way the system is not proper, and due to our ill effort, or due to probably as we are moving in a wrong path, we might land up in trouble. Now, what are the factors which can influence work stress? The drive for success. If I want success, that means in every financial or every second financial year, I am moving from this company to that company. That means excessive drive for success. I need growth and growth. So if I very much concerned about this, very much concerned about success, then this might put my work as a stressor. Changing work pattern. Suppose I used to work earlier from 10 to 5. Nowadays, as my responsibility has gone up, I am working in the office up to 8 p.m. in the evening. Or my scholars, the number of scholars has increased, or their submission date is in the near future, so I have to complete my research at the same time their writer also, so I am spending time more and more time in the lab, so I am reaching my home at 10 in the night. So this pattern of changing work will put pressure or put stress in my life. Working condition. Suppose basic amenities are lacking in my office, or I am not giving physical comfort. Suppose my office is very small, or my the proper light and proper air is not proper aeration is not available. So this adverse working condition may be a stressor for us. Overwork, even underwork, you are very much boredom. You do not have any work to do in the department. You do not have any class. So this underwork may be a when you get bored, it will be a stressor. Uncertainty means suppose I am a contractual worker. I do not know in the next financial year or next academic year whether I'll be given chance to work in this particular department. I do not know. So there is uncertainty about my profession and career or my job. So this may be a stressor. Conflict means it is a situation where we cannot take any decision. Suppose there is a issue or a difference of opinion on a particular topic with your boss. So there is a conflict. So this conflict will give rise stressors. Responsibility. If I am being given more and more responsibility, this will be a stressor for us. Relationship at work. If my relationship with my colleague, with my fellow mates, with my peers are not good, my job place will be very much painful for me. Change at work. Earlier, I am being given, I used to do a morning shift, now I am doing night shift. So this change of work or pattern of work will be a stressor for me. Now I'm not going to read out all these things. Already I have explained these things. So I am just skipping part 3, which is the main component, self-help. Now, how to help ourselves to get rid of or to come out of this stress? What's our do's and don'ts? I'm just trying to giving you outline. By now, you have understood what are the elements or what are the components at my job places, at my workplaces, which is giving stress. That means you could have identified the stressors or the conditions, and you have to manage all these problems or stressors at your level. That means coping strategies. And how to do coping, what maneuvers you have to handle or you have to do, I'll explain in this part. Remember one sentence. Not all stress we experience is generated at work. It's not that in the office I am feeling low, or I am distressed, or I am not able to put concentration on my work. It's not necessarily that the stressor should lie in the office. Even your family disharmony, your conflict with your wife, conflict with your children can act as a stressors, and you are taking or carrying these stressors with you in the office. So already I have explained what are external stresses and internal stresses. No need to read out all these things. By now you know all these things. So you agree with this statement? Not all stress we experience is generated at work. Try to remember that. Recognize your problem. Whether the problem is your argument or difference in opinion with your boss, or it's you are not able to raise your level of work or quality of work. Suppose expectation of your organization is more than you are liable to do, then you will be exposed to stress, which you already have said. Now you have recognized the problem. Now I will explain how to come out of this problem. First is ABC strategy. Try to remember ABC strategy. What is ABC strategy? I'll explain. A is for awareness. What awareness you should have? What causes you stress? How do you react? Suppose this morning my professor has asked me to do or asked me to take today's class. So is it a stressor for me? If it is a stressor, whether it is a justifiable stressor or injustifiable stressor, I have to understand or I have to analyze, and then only according to the analysis I have to react. Next, B is for balance. There is a fine line between positive and negative stress. How much can we cope with before it became negative? Suppose a problem is there, I should be able to handle it easily. When I won't be able to handle this, then the positive things will become negative. Next, C is for control. What can you do to help yourself to combat the negative effect of stress? So, stress management technique. Under that heading, I'll explain: change your thinking, change your behavior, change your lifestyle. 3 changes we have to bring in our life so that we can handle those problems, we can handle those stressors. First is change your thinking. That means we have to reconstruct our thought process. One gentleman called Aaron Beck, who has given the concept of Beck's triad of depression. That means a person who is depressed, he will be always having negativity towards self, negativity towards surroundings, and negativity towards future. That's called the Beck's triad or Beck's cognitive triad in depression. So while managing or while treating such depressed patient, we in the counseling session, we always try to reconstruct or reframe the thought process, how he or she is thinking. That's why it's called cognitive repair or cognitive behavioral therapy. We have to change all negative thought process to positive thinking. We have to bring positivity in our thought, in our activity, in our behavior, thereby having less effect of stress. Now, how we can do reframing? Reframing is a technique to change the way you look at things in order to feel better about them. Many ways to interact the same situation, so pick one you like. If we do not want to reconstruct your thought process, in the long run, you will be in trouble. Your colleague or your family members, they may not be in the problem, but you will be exposed to problem in near future. So how to inculcate the positive thinking? Forget powerlessness. I am inefficient, or I am worthless. You have to erase this type of thought. Stress leaves us vulnerable to negative suggestion. Suppose when you are in trouble, many of your friends will, give you some suggestion, and many a time it happens that you grab the negative aspect from that discussion. You have to avoid those situations. You have to focus on the positive thought process. Focus on your strength. Learn from the stress. You are suppose similar situation you are being exposed earlier. You have to remember how you tackle those problems earlier. Your previous experience will help you to come out from this situation which now we are exposed. Look for opportunities, see out of the positive and make changes. Now if you escape from the situation, you will be you will be in trouble again and again. Rather, you should solve the problem. Now, how you change your behavior? Be assertive, means be positive. Get organized. Ventilation. You are having grief or bad thoughts in your mind. You should express these things to your colleagues, to your peers, to your friends. So ventilation is needed. Sometimes laughter or humor is needed. Diversion and distraction. Suppose at this moment I am not being able to concentrate on this topic, so I'll get up and I'll have a cup of tea. I'll spend 1 or 2 minutes outside, then again I'll come to my desk. So these are some patterns of behavior which can inculcate positive behavior or assertiveness in your thought. Already I have explained being assertive means how to be positive. Remember one thing, the positive person, the assertive people, they respect themselves and others. They take responsibilities for action and choices. They ask openly for what they want. That means they can pinpoint their expectation. It's not a vague thing. If there is disappointment, they just avoid those things. The self-confidence of these positive people or assertive people are very high. So we have to acquire that type of behavior. And they do not depend on approval or appraisal for others. They know that whatever they are doing, probably they are the right thing. So how to have this skill? Establish good eye-to-eye contact. Don't stare. Stand or sit comfortably. Don't fidget. Talk in a firm or steady voice. Use body language and give away the message that I think or I feel. That means clear-cut communication with your subordinates, with your colleagues. What do you think on this particular topic or particular situation, and how the other person thinks? Concise and to the point communication. What are the benefits if you become positive? There will be higher self-esteem, less self-consciousness, less anxious, manage stress more successfully, appreciate yourself and others more easily, feelings of self-control. That means there will be less chance of giving away. So getting organized means you have to formulate or you have to organize your problem, or categorically you have to divide your working goal. If you organize your activity, the stress will go down. Very important topic, very important aspect is time management. Make a list which should include what you must do, what shouldn't be done, and what would you like to do. Then cut out time wasting. Try to cut down your coffee break or smoking break or gossiping break. Say no to other ill aspects, like do not dump your work or procrastination phenomena. That means you do not work until the deadline comes. So don't wait for that deadline. Plan your day, set achievable goal. Don't waste time in making excuses for not doing something. Ventilation, which I already explained. Humor, that means cracking jokes, or spending time with good TV show is very helpful. Diversion and distraction. Take time out, get away from things that bother you. Doesn't solve this botherness won't solve the problem. And diversion will help in reducing the stress, will make you calm, and they will help you to think logically. You have to change your lifestyle, like diet. I'll explain. Smoke and alcohol, exercise, sleep, leisure activity, I'll explain. Now diet, it should be healthy diet, it should be balanced diet, not being stuffed with this junk food. Caffeine, it should be moderate. Salt quantity should be as less as possible. Smoking and alcohol, regulate your consumption. It's not that I am being stressed or I need to work throughout the night, that's why I want one packet of cigarette. So practically or scientifically, I'm telling you that more addiction, you will end up in more and more trouble rather than solving the issues or solving the problem which you are having at this moment. What are the benefits of exercise? Use up excess energy released by the flight or flight reaction. That means the excess hormones or chemicals which is being released from your adrenal gland, that is the catecholamine. By doing exercise, this excessive catecholamine will go down. The heart rate will go down. Heart rate means the pulse will go down. Your systolic BP will go down. You will have a clear vision of your thought and mind. Improves self-image, makes you feel better about yourself. Increase social contact. Suppose when you do exercise and when you sweat profusely, our brain releases one opioids called the endogenous opioid. I'm giving you examples of names of few endogenous opioids like endorphin, dynorphin, endomorphin. These are some opioids which will be released from our brain, and ultimately these opioids will elevate our mood, thereby improving our relationship. I'm giving one more example. Suppose when a person gets orgasm, our brain releases this type of chemicals called endogenous opioid. Now when this is being released in our brain, our mood gets elevated and very much soothing environment comes into play, and the interpersonal relationship gets improved. Suppose your relationship with your wife improves, your understanding or everything goes in a right direction. That's why exercise is beneficial for us. Coming to sleep, good sleep is a good stress reducer. When you are being exposed to distress, many times we have seen that the person comes to us with a sleeplessness. But if we can induce good sleep, the level of stress goes down. If you see in the computer, we refresh, isn't it? We refresh time to time so that it doesn't get hanged or it doesn't get slowed. In our body also, sleep is needed to refresh ourselves so that with full energy, full vigor, the next day we can start our day again and with 100% effectivity or efficiency. So sleep restores our body energy. Leisure activity is not that every time you should spend time, from 10 to 10 p.m., 10 a.m. to 10 p.m. You should be in your office, in your desk, or in your lab. It's not that. You must have good time, good leisure activities. So time to time you should take break. You should you should attend national seminars, thereby having a good break and good family outing. It provides outlet for relief and provides social contact. That means whenever you take break and you go or attend a national program, thereby it will enhance your social contact also. What are the benefits of relaxation? It lowers blood pressure, it combats fatigue, it promotes sleep, it reduces pain, and it's muscle tension, backache. It decreases worries, increases concentration, increases productivity, and increases clear thinking. What may be the alternative things? Conventional medicine. If you are being stressed, you should take proper assessment. You should have proper assessment. You should, if needed, you should consult your doctor. Counseling may be needed. Sometimes behavioral therapy like relaxation exercise, meditation, massage, yoga therapy, acutherapy, acupuncture, all these things are helpful. So I have tried to, in this session, this part 3, I have tried to discuss the identification that you have identified. What are the stressors, what are the distressing factors in your organization, how to cope with that problems, and what are the alternative methods. Thereby I am finishing my talk, today's talk. I'll be happy if we raise your queries, so that I want this topic I have chosen in such a way, I have chosen a topic in such a way which should be beneficial in your day-to-day life. It's not a theoretical thing. It has an implementation and manifestation in our day-to-day life. So if at all any difficulty, any queries are there, I'll be very happy to answer. And thank you very much for your patience hearing.
Thank you, Dr. Ghosh. Thank you. It was a wonderful session, and it was very informative. It was very delightful. So no words. Thank you, sir. So I will request all the participants to put their questions in the chat box, or you can directly unmute yourself, ask directly to Dr. Ghosh.
Sir, I have sent you the MCQs.
Yeah, we've got it.
Mr. Jasimuddin, he said, what is the relationship between stress and blood pressure? Yes, very nice question. See, when you are exposed to the slide, you try to remember, when you are exposed to stress, our hypothalamus will release corticotropin releasing hormone. Now this corticotropin releasing hormone will act on anterior pituitary. As your physiology, related to human physiology, you will be knowing all these things, that this CRH, corticotropin releasing hormone, will act on the anterior pituitary, thereby releasing anterior adrenocorticotropic hormone. This adrenocorticotropic hormone will act on the adrenal medulla. When the adrenal medulla gets stimulated, there it will release catecholamine like epinephrine, norepinephrine. When the epinephrine releases, it will act on the beta receptors of the heart, thereby increasing the pumping or pumping velocity, and the quality and quantity will increase, that thereby releasing the systolic blood pressure. At the same time, pulse rate also goes down. Sir, would you be pleased to repeat the relationship on stress, endocrine function? Yes, sir. Josim bhai, I have explained all these things. Please say something about artificial competition and stress. Yes, very relevant thing as of now we are facing. Every parents we are facing, and every person in this society we are facing. Always try to have this notion that we should have competition with ourselves, because there is no ending in this thought process. there is no full stop where to stop. Because if we compare with ourselves, suppose my colleague's son has got good marks in the exam, or he has become topper in the class, and my son is not at all topper. So if we are comparing his son and my son, it will be a stressor for my son, at the same time for us, that is me and my wife. So every child, everybody has different domains where they are excellent. Maybe your colleague's son is excellence in academics, and your son is excellence in other aspects like drawing, public speaking, managing the real-time crisis. So if we compare head to head, then it will be a stressor for you. So we should avoid as far as possible. Rather, we should inculcate the positive aspect in our children, or we should inculcate positive thing in ourselves. Suppose if I think that my colleague, he is earning 10 lakhs a month and I am earning 1 lakh. If I compare, this additional 9 lakh will be a stressor. Rather, if I think last month or last year, my net income was this much, and this year my net income, just I am giving you one example. It's not that income is the only thing. Suppose last year my publication was 4. This time I'll try to raise my number of publication to 5 this year. So I have to have competition with myself only, not my colleague. In that way, I think you can reduce your stress. Mr. Josimuddin, anything? Thank you. And seriously, I'm requesting you to put questions so that I can get chance to answer your queries.
Yes, still time is there, so anyone can ask questions.
Sir, these MCQs, should I utter these MCQs or
not yet, sir? We will take the exam at
okay.
the session.
Okay.
So
why I have given, sir? Why I have given excess MCQs so that you can, selection bias won't be there.
Okay.
That's why I have given 3 times the number you asked for.
Thank you, sir. Thank you. So I can see 2 questions in the chat box, sir. You just see it.
Can you please show slide number 24? Okay. Let me see which one is 24 number slide. Yeah, positive stress. Is it visible? Oh no, I have to share that. Can you see?
Not yet, sir. Yeah. Now it is gone.
Okay. Now, what was your question? Let me have your question. Can you please show the slide number 24? Okay, I have shown any queries from this slide number 24?
Dr. Kollol Das, if you have any question from the 24 number slide, you can directly ask.
Sir, I don't know whether you can hear me, but
yeah, I can hear you.
Dr. Santanu Ghosh, I think we need to talk about something positive, and can you lay a little bit more, points on what exactly will be positive stress in individuals? Is that possible?
Yes. I'm just giving you
about positive stress.
Yes. Positive stress Am I audible, Dr. Kaul? Am I audible?
The voice is low, but I'll manage to hear, sir. Don't worry.
Okay. Suppose in your college or in your organization or in your university, the academic session starts from January to December. I'm just giving you one example. From the suppose 50 number of students get admitted in your department. Suppose now January month is going on. Just there, the students were admitted. The classes have not been started. So what the student will do? They don't have any stress in their life. There is no demand, academic demand. There is no academic stress. So their performance is less. As the time moves from January to March to April, the departmental activities, the academic activities, the frequency and the number of session per weeks is increasing. Probably the assessment, the exams, the tests are coming. So whenever there is little stress, the student performs. It is being seen that for performance, a little bit of stress is needed. Now, if this little bit of stress profusely goes up, then the performance again goes down. So it is being established phenomena that for a better performance, little bit of stress is needed. That thing is called the U stress. And if we plot in the in a graph, suppose x-axis will be depicting the time and y-axis will be the the performance. As time goes and the stress goes up, that's the academic demands goes up, the student practically performs more in this period. So for better output, better outcome, better result, we need little bit of stress. That's why we call it positive stress. Suppose I'm associate professor and departmental promotion is DPC is going on. So 2 months down the lane, if I am being promoted to professor, it's a good thing. And more responsibilities will come into play, and more added responsibilities will be given by my organization. So these things will be the positive stress. This will be the U stress. Dr. Kaul, am I audible to you?
Yes, sir. I can. Yeah, yes, sir. I have put in now earphones, so I can hear you probably. So,
okay. So for better outcome, positive stress is needed.
So that would mean that actually people should be given some kind of appreciation,
some kind of stress, some kind of stress. Yes, sir. As you are teacher, that's why I have given you example of students.
No, I'm saying appreciation. People should be appreciated for the work that they are doing, so that they are able to take up more stress.
Yes, I have explained in between. Already explained. Suppose job appraisal will motivate us. Suppose every year appraisal comes in the month of March and April. This appraisal comes. Now, why? What is the reason for this appraisal? Because if my staffs are given reward, they are having motivated to repeat that similar activity. Suppose I am giving you example. Suppose I am persistently performing and there is no appraisal. The next financial year or next academic year, I'll be demotivated to do the similar activity. So my performance will go down. But every time, if I am having good appraisal or good words or appreciation from my boss, from my department or from my organization, then every time I want to repeat these activities. In our brain, one particular area in our brain is called nucleus accumbens. So every time you perform nicely, the dopamine, a neurotransmitter called dopamine, it is being released from that nucleus accumbens. So whenever appraisal or good words or appreciation comes, this dopamine is released. Suppose I am giving you example. Sir, Dr. Kallal, how old you are? That's my example should depend on your age. You are senior faculty or junior faculty?
I'm quite old. I'm 59 years.
Okay.
I'm a senior faculty. I'm 59 years old right now.
Oh yes, sir. Actually, I always try to give example in such a way so that the listener can put themselves on that situation. Suppose you are almost on the verge of retirement. Now, at this age, if your organization gives you a monetary benefit or a special recognition, yes, you are the professor in excellence. So what will happen? You will get motivated to continue the same activity in the department rest of the year, 1 or 2 years, so the remaining period of your profession in this department. So every time when you get appraisal or reward, this nucleus accumbens in our brain will have the dopamine, and due to this dopamine you will be you will repeat the same activity. That's why this reward phenomena dopamine is essential. So I have tried to explain the neurobiology of that reward also while explaining the positive stress, isn't it, sir? Sir,
Yes, sir. Thank you. I'm putting absolutely, sir. That is very nicely put. I'm putting in a small suggestion.
Yes,
Over here. Small primers in the subject, if they are put out and circulated, that will be very useful for people who are managing a large group of very committed people. Because
yes,
appreciation is a very essential. So I'm putting in one small note for if that is possible. And,
thank you, sir.
Circulated. So thank you very much.
Okay.
It was very
So Dr. Ghosh,
to hear
any
from
more
somebody
question?
who has had vast experience over here, and I enjoyed
Thank
it.
you, sir. Thank you.
So thank you very much.
One question: is stress related to homeostasis? See, homeostasis means the changes in our body according to the situation. Okay. Now, when this homeostasis fails, when the resilience fails, the ill effect or bad effect of stress comes into play. So, our body tries to, face that situation and alters itself within it. When this system fails, that means the homeostasis fails, the ill effect of stress comes into play, or you can see the ill effects of stress. Any question? Asha sir?
okay. So since we do not see any other more questions, so we are done here. Or if any other question is there, so participants can directly send email to Dr. Ghosh.
Yes, sir.
So
I'm just in the chat box. I'm putting my email ID.
Yeah, that will be fine. That will be fine. Yeah, it is there.
Any academic query, any queries related to mental health, you can ask me. Today is 8th October, 10th October is World Mental Health Day. So regarding mental health, if at all there is any query or you need to know something, just mail me or you can text me also. I am putting my number also. You can text me also.
That is so fine. So thank you, Dr. Ghosh. Actually, Dr. Hussain is on another assignment, so
Okay.
he conveyed his regards towards you. So thank you very much. It was a very refreshing session. It was a very
Please
important.
convey my regard to him also.
Thank you, sir. Thank you very much. So we are done here. Thank you, sir.
Thank you.
So moving ahead, we will be having our second session of the day at 12 p.m. So in that session, Dr. Ratan Dash will be give his lecture. So we'll wait for some time and we'll start the session at 12. So participants, you can take a small break, but please join by 11:55. Thank you. Ratan sir. Sir, you there? Ratan sir?
Yes, Ritinava.
Yes, sir.
Yes,
Sir,
I am here.
okay. Arshad sir is on another assignment, so we'll start the session within few minutes, sir.
Yes, yes, no problem. Start.
Okay, sir. Okay. Very good afternoon to all the participants. We are heading towards the second session of the last day of this faculty development program on progress on 2D materials. So this session will be presided over by Dr. Ratan Dash. Dr. Dash, after completing his MSc and MPhil from Assam University in the year 2005 and 2008 respectively, completed his PhD from Assam University Silchar in 2012. He joined as an assistant professor in the Department of Physics, Tripura University in the year 2012. He has established the Nanophysics and Nanotechnology Research Lab in the Department of Physics, Tripura University. His field of research work includes synthesis, characterization, and application of noble metal nanocrystals, semiconductor nanocrystals, and magnetic nanoparticles. His research interest lies in the field of optical, elastic, and magnetic properties of different synthesized nanomaterials. Also working in the gap modification, phase transition, and defects creation in materials through swift heavy ions irradiation. Magnetic properties analysis by neutron diffraction method. In the application part, his research work includes sensors, antibacterial activity, LED, biofertilizers, soft ferrite, magnetic application of nanomaterials. Broadly, he is specialized in X-ray diffraction analysis and Raman spectral analysis. He has published more than 61 research articles in different peer-reviewed national and international journals and attended more than 40 national and international seminars and conferences. He has more than 940 citations. 2 research scholars have already received PhD degree under his guidance. 4 PhD scholars are presently working under his guidance. He is the project investigator of ongoing 2 major research projects funded by DST SERV and 2 minor projects research funded by IUAC and BARC BARC project with a total grant of rupees 89 lakhs approx. So I welcome you, Dr. Dash. Please take over the charge.
Okay, thank you very much, Retinaba. Good afternoon, everyone. Okay, without wasting time, let me start the session. Is my screen visible, Retinaba?
Yes, sir. You just make it in slide share mode.
Yeah, no problem. Yeah, now it is in full screen.
Yeah. Visual
Okay.
and audio both are crystal clear.
Okay, fine. Okay, let me start. So again, good afternoon, everyone. The topic that I shall discuss about the influence of SHI-induced microstructural modification on the optoelectronic properties of a few semiconductor nanocrystals. I have taken here CdS and CdSe nanocrystals and suitable material for solar cell and power generation applications. Okay, I am Dr. Ratan Dash, Assistant Professor from the Department of Physics, Tripura University, Tripura. So as the title includes SHI-induced microstructural modification, so we should know that what is SHI, and how does it influence the properties of nanomaterials and thin film. So right away the answer is the swift heavy ions, and these swift heavy ions we use generally in the experiment is in the range of around 100 MeV. More than 100 MeV is there, less than 100 MeV is there. But as per our suitable experiment, we just use as per our need, and it remains in the MeV range actually. So this swift heavy ion irradiation is a special technique generally used for manipulating the structure of materials at the nanoscale or a thin film, basically for the sample where we do want to change the manipulation without damaging the sample, and as basically this remains, the sample remains in the thin film, and it is almost 2D materials. So we do irradiate the sample with swift heavy ions, and there we find some structural modification, and we can do the structural modification without damaging the sample, right? Now during the irradiation, what happens that this heavy ions, swift heavy ions, they get deposited. I mean, they pass through the sample but deposit the high amount of energy to the system of the target material, and that took place, or that takes place in general in the sub-picosecond time scale. This is a very fast and swift process through which within a sub-picosecond time scale we may get some modification in the sample, and the advantage is that we can do it without damaging the sample. So this SHI irradiation actually they forms a cylindrical damage zone, as we can just simply see in the right hand picture, that when SHI irradiation pass through the sample, they produce some cylindrical damage zones of diameter in the nanometer range called as ion tracks along the linear trajectory of the sample. And depending on the material as well as the sample size, different defects that takes place in the sample, such as densification, phase transformation, amorphization, these sort of things that takes place in the sample, and that directly actually modifies the microstructural parameters. The microstructural parameters actually nothing but the grain size, intrinsic strain, dislocation density in the sample. Okay, so one particular ion while passed through the sample, they may produce a ion track, and there are lots of ions, swift heavy ions are there. They pass through the sample and they produce different ion tracks, and thereby they produce the modification, or they modify the sample through phase transformation or some sort of amorphization or some sort of all sort of things that actually modifies the microstructural parameters, and these microstructural parameters are very important to study actually. Now, as I just want to add up here that SHI irradiation transfers the energy to the sample by inelastic collision with the electrons in the sample, which excites the lattice electrons, and thereby through this inelastic collision result in ionization of the charge carriers, as well as it may produce a displacement of the atoms from their original position. We can see here on the right hand side in the second slide, you can see that there are some displacement of atoms that takes place in the material, and thereby lots of defects and many sort of dislocation density that takes place in the sample, and this thereby creates vacancies and different types of defects as well, which I want to reiterate the things that SHI irradiation is a very faster method of producing vacancies and defects in the sample without damaging the sample. That's the advantage, and it finally modifies the microstructural feature of the sample actually. Now this microstructural changes in the sample affects the optoelectronic parameters such as dielectric constant, refractive index, etc. And these parameters are very important for any changes in these parameters are related to the solar cell, because solar cell contains needs no modification of dielectric constant and refractive index, because solar cell depends on these parameters. So for solar cell application purpose, we need to have a good or suitable dielectric constant and refractive index. And as I want to go back again to the title, that title is related to the suitable material for solar cell and power generation application. So we are just trying to modify the microstructural modification in the sample, and thereby which affects the optoelectronic properties, and this modification may lead to a material which can be used as a solar cell and power generation application. I shall go to the power generation application part later, but I want to say that for suitable solar cell application of a material, we need a suitable dielectric constant and refractive index. So here we are trying to modify the sample so that we can get a good or better dielectric constant and refractive index so that it can be applied as a solar cell material. Now, before going to the application of solar cell and before getting the optoelectronic parameters or any changes in the optoelectronic parameters, we need to understand or need to study or need to get the microstructural properties or any modification in the microstructural properties of the sample that anyone can take. And these microstructural properties can be studied simply through X-ray diffraction analysis, because X-ray diffraction analysis is an important tool that gives us the microstructural properties in a very systematic way or in a better way. With this motivation, behind this motivation, we have studied the SHI radiation effect on different solar cell parameters of PISTA and CdS. And this SHI radiation has been studied in terms of energy deposition. Okay. Now, where can we get this SHI radiation facility? It is there in IUSC New Delhi, and this is the only facility available in the India. There are some other facilities there outside India in 2-3 countries, but India is we are very fortunate that in India we have a facility like this, and it is there in the New Delhi at Inter University Accelerator Center. And they are see in the picture. Okay, let me take. Yeah, in the picture we can see a tomb-like things, and this is the actually where the sample of irradiating sample is actually fed, and here swift heavy ions are produced, and different ions are available at IUSC. All the list, a few list I have included here, but I have used the nickel and silver ions of 120 MeV range for the modification of the sample of CdS and CdSe nanocrystals. So this is a facility where anyone can avail the beam time, and someone needs to write a particular proposal, and once it is get accepted, anyone can avail this facility and use for the research purpose. It is there for the research facility as a research facility provider to the university people or other research faculty members there. Okay, so I have taken one particular sample of CdS and CdSe nanocrystal and thin films, and we have irradiated the sample with silver and nickel ions of 120 MeV range, and we have studied the microstructural properties changes in the sample through X-ray diffraction analysis. Okay, now before going to the actual experiment, we need to do some simulation work behind the proper application purposes. But before going to the irradiation, we need again I am telling that we need some simulation. We need to do some simulation to get some properties or get some parameters, so that it may give us an idea which material, which particular ion may be used, because these are very costly effect. You cannot choose the ion just out of your box or out of your imagination, but you need some basic background behind choosing a particular sample or a particular ion. So and yes, okay, I shall go to that part. Here I want to say that we have prepared CdS and CdSe nanocrystals through chemical method, and then we have prepared the thin film out of these through through spin coater technique, or even a normal casting method also effective. But if you do the spin coater, or if you use the spin coater, then you can better prepare a sample out of this. And after preparing the sample, we have dried it in normal temperature, and then we went for ionization experiment with 120 MeV nickel and Ag ions. Now the fluences are around 1 into 10 to the power 11 ions per centimeter square, and I have used the three actually fluences, the 10 to the power 11, 10 to the power 13, and 3 into 10 to the power 13 ions per centimeter square. Now, as I have talked about the simulation, so we did the simulation work where the stream actually is a particular package, and we use the stream simulation for getting an understanding behind how does a particular sample or how does a particular ion will interact with the sample, and modification will take place. Now, whenever I have used that Ag and nickel ion, I have found that the electronic energy loss is much higher than nuclear energy loss. Okay, so deposition of electronic energy loss is more in that particular sample, and we need that actually. And we have found that for Ag ions, the electronic energy loss is more than nickel ions, and the same thing is also for CdSe. In the case of CdSe, also we have found that the electronic loss energy due to silver ions is more than nickel ions, because it is related to the mass of the ions, and as it is as the mass of silver ions is more than nickel ions, so that silver ions is producing more electronic energy loss in the sample. Okay. Now, there are some other things that you need to see, but I am just saying that you need to do someone need to do some stream simulation before going to the before proceeding to the experiment. Okay. Now there are some stream simulation that transport of ions in matter program. It is the same package here. Stream and trim both are there in the same package, and it is freely available software in the you can Google search it, and you can download it, and you can do it at your own, because in our MSc lab the students are also using this particular the package for just simple simulation experiment. Here in the trim simulation, what happens that we can get some displacement damage against the sample depth. So if you do this particular trim simulation, you can get an idea that how far we can go, or how far in the sample but that particular ion may produce the damage, because we need some damage. This damage actually modifies the sample, modifies or creates defects, as well as it creates some or increases the dislocation density in the sample. So after doing this particular simulation, we can get an idea about the depth, and thereby we can prepare a sample whose width or depth must be less than this particular damage profile. Okay, so that the whole throughout the sample, that particular sort of things may take place actually. So before going to the experiment, one need to do some stream and trim simulation. I don't want to give more time in discussing these things, because we shall go further. So we did some simulation in the case of that nickel, and trim simulation in the case of nickel and silver ions, but we found that silver is giving more damage, displacement damage in the sample, and compared to the nickel actually, because it is more heavier. After doing this, doing the irradiation experiment into this particular two samples, we have gone through then we have characterized the sample through SAM, and here we have found that this is for pristine sample actually, unirradiated sample, where it shows uniform size distribution of the nanoparticles, and which has a average grain size of 25.7 or around 26 nanometer. But after irradiation, we can see that that the sample is not that much uniform. Some agglomeration or grain modification takes place after irradiation, and the average size is increases from the 26 to 29 or 30 nanometer for CdSe, and that 33 or 32 nanometer around for that CdS actually. And see, we can also explain this particular. Now you see, this is for 120 MeV nickel ions and on the CdSe, and this is for Ag ions on the CdSe, and Ag ions is giving more increase in size because it is more energetic, or electronic energy loss is more higher, and this can be explained. This modification in the grain size can be explained on the basis of thermal spike model, because as per thermal spike model, this is the model actually behind there in the SHI irradiation effect. Theoretical explanation is there in the thermal spike model, but as per this model, what happens that sudden rise in the lattice temperature takes place when a particular fast moving ion or highly energetic ion goes through the sample, and that result in the melting of lattice temperature in a very short interval of time, and thereby it again agglomeration of grain takes place, and thereby it increases the particle size, and which has been observed in the same micrograph actually. And this is the result of the SHI irradiation on CdS nanocrystals, and you can see that average size has been, it is around 12.55 nanometer for crystalline sample, and after irradiation effect, we have found the increase in average grain size to 14 nanometer and 16 nanometer respectively for nickel and Ag ions respectively. After that, we did some AFM study, and AFM study gives us the surface roughness about 3.6 nanometer. And after irradiation, we have found that roughness increases, and this also further confirms, in addition, that yes, there are some modification that takes place in the sample after SHI irradiation. Okay, as I told you that to study the optoelectronic properties, which actually dependent on the microstructural properties, because microstructural properties are affecting the optoelectronic properties of CdS and CdSe nanocrystals. Now, to study the microstructural properties, we need to do some X-ray diffraction analysis, and we have taken the X-ray diffraction of data of that CdSe, and this shows some peaks at around 25, 28, 42.37, 48.25, corresponding to the 111, 200, 220, and 311 planes respectively. And all these planes are as per our JCPDS software, and this is matching actually, and this is corresponds to the cubic structure. But after SHI irradiation, or during the SHI irradiation, as I have irradiated the sample with 1 into 10 to the power 11, 1 into 10 to the power 13, and 3 into 10 to the power 13 fluences. So with the increase in fluence, what happens that these cubic planes, 1 planes and other planes also getting distorted or modified as after irradiation effect. And at the highest fluence of 3 into 10 to the power 13, we have found complete changes in the structure from cubic to hexagonal, because all these peaks are related to the cubic phase of the sample. So CdSe after irradiation at the highest fluence of 3 into 10 to the power 13 completely changes its or phase transformation takes place from cubic to hexagonal phase. Okay, this is very important, because with this phase change, obviously there must be some changes in the microstructural parameters, and this is the effect of Ag ions also. There also we have found some modification or phase transformation in the CdSe nanocrystals from cubic to hexagonal peaks. Similarly, you can see here the most intense peak of the XRD pattern, and the piston has been observed in the range of 20 to 29 degrees centigrade, which is used for the phase purity of the phase and phase para pattern. You see here we have taken the most intense peak, and the most intense peak is for the piston sample is this 1 peak, but it is getting modified. You can see with the irradiation at the fluence of 310^13, the single peak is getting converted into 3 peaks, and this is nothing but the phase of the hexagonal phase of CdSe. And similarly, we have found in the case of Ag ions also. But the difference is that difference is there in the intensity of nickel and Ag ions, because the Ag ions giving more intense peak in the case of CdSe. Similarly, in the same way, after irradiation with nickel 10 plus ions and Ag 7 plus ions of 120 MeV, we have seen or have observed the changes in the phase after irradiation. Actually, changes in the phase means phase transformation from the cubic to hexagonal phase that took place in the case of that CdS nanocrystals as well. Now, for microstructural modification and analysis, or to get the microstructural parameter, we need to do some extra diffraction and peak profile analysis, right? And in the real crystals, many factors affect the diffraction peaks and result in peak broadening and peak shift and peak asymmetries as well. Okay, we shall see that how does it affect the peak broadening as well. Now, in the real crystal, or generally in a particular perfect crystal, that I can say that broadening of a single peak may take place due to many factors. One is strain. There are some instrumental effect. There are some crystalline size effect. All these things are there. But for an ideal XRD line, that line should be only a delta function, single line. But in the case of a real sample, some sort of broadening we shall obtain. And this broadening that takes place, I have told you, this is because of different factors like strain, instrumental effect, crystalline size, etc., etc. And there we shall get some full width at half maxima, and this parameter is very important because that width at the half of the maxima of the XRD peak, this parameter is very important for analyzing the microstructural parameters and other factors. This is very important as well. So we need to get this full width and half maxima. But there are some instrumental effect. So before going to get the full width and half maxima, we need to correct this instrumental broadening effect. And we get rid of this instrumental broadening effect by simply taking or simply subtracting the instrumental effect from the measured one, and to get the correct broadening actually. Now, to get the instrumental broadening, we need a particular proper sample, silicon as an ideal sample, and putting the bulk sample in the XRD analysis part or XRD diffraction part, and then we can get how much broadening takes place. And after getting this that particular instrumental broadening part in the case of a standard silicon sample, obtaining this particular value, we may get rid of the instrumental broadening. But instead of this, the residual broadening that may consist of crystalline also there. Okay. Simply, we may use the full width and half maxima by after correcting the instrumental broadening effect. We may take this full width and half maxima for calculating the size, and the crystalline size is can be obtained from the Sharar formula actually. And this is very well known. No need to explain those things, because Sharar formula is very useful in obtaining the crystalline size. But as I have told you, there are some other effects are there, strain effect and defects related effects are there. So to get those effects, or especially related to that intrinsic strain, we need to understand that what are the origin of these intrinsic strains. Okay, so that origin of this intrinsic strain may be related to the different defects, different vacancies that are there in the sample, which may distort the normal pattern of the sample or normal arrangement, and thereby it may produce some intrinsic strain in the sample. And this intrinsic strain may be obtained along with the size by different methods like Williamson-Hall method, Helder-Wagner method, size-10 plot method, Warren-Warburg method, Boyd method. All this we have done, but simply I shall explain here the Williamson-Hall method. And this is very simple one, and that I don't need to explain all these things. Okay, let me get into the fact of that the Sharar formula that gives us the size, but related to the strain, we may have the contribution to the broadening, as the strain is equal to 4 epsilon 10 theta, and this is as per Stokes, or what is known as Stokes, as Stokes considered that deformation or strain induced broadening during the processing of the or formation of the nanocrystalline sample, or due to the ionization method. So the classical Williamson-Hall, this is a very simple one, and through which we can obtain the strain that are there in the sample. But in this particular classical Williamson-Hall method, we consider that the strain that is there in the sample, it is uniformly distributed, it is isotropic in nature, and considering this particular isotropic strain in the sample, we proceed with this, and we find the strain in the sample that is there by classical Williamson-Hall method. And it is nothing but the total broadening, by considering the fact that total broadening is due to the crystalline size effect as well as the strain effect, and then by some just rearrangement of this particular formula. And if we do plot these things, delta K versus this particular K, and where K is that we have already seen that K is equal to 2 into sin theta by lambda, and delta K is equal to f scale into cos theta by lambda, where f scale is the width, or rather I can say beta scale is the width. So plotting these things and from the particular slope and the intercept, we can obtain that average size and the strain as well. Okay, so average size has been determined from the intercept as 28.12 nanometer. Now for that 120 MeV nickel ion irradiated sample, and for Ag irradiated sample, we have obtained the average particle size, and this has been increased from 30.5 nanometer to 33.7 nanometer from the pristine 28.12 nanometer. Okay, so this gives us an idea that that XRD analysis also giving us that fact of that increase in the grain size that we have already obtained from SEM analysis. And the strain value has been also found to increase from the slope after SHI irradiation to the value of 4.3 into 10 to the power minus 3 for nickel irradiated CdSe, and 5.05 into 10 to the minus 3 for Ag irradiated CdSe. Okay, so we have seen some increase in the value of that grain size as well as strain. Okay, and this is for CdS nanocrystals as well. CdS nanocrystal also giving us an idea about increase in particle size. This is the pristine sample where we have found that that average particle size is around 11.25, and the strain is 3 into the minus 13, 3.13 into 10 to the minus 13 particular value. But after ionization, we have found significant increase in the particle size as well as increase in the value of the strain. I did not include here the values, but we have found some increase in the value of the particle size as well as the strain. Now, as I have told you that in the case of classical Williamson-Hull method, where just let me go back. Yes, in the case of classical Williamson-Hull method, we have considered the isotropic strain, means strain that is there in the sample that is isotropic in nature. In every direction, we just get that same strain in the sample. But in the case of modified Williamson-Hull method, where we do consider anisotropic strain, means in different direction, different strains are the value of strains are different in different direction. And this particular modified Williamson-Hull method considers the fact that that anisotropic strain can be obtained considering anisotropic contrast factor. This is a particular important factor, and this particular factor is related to the dislocation density, as because dislocation density is considered as the major source of anisotropic strain in the sample. Okay, as I told you that that ion irradiation actually produces different defects and that sort of things, or dislocation density, because the atoms may get shifted from their original position, thereby it affects the dislocation density in the sample. With this consideration of anisotropic strain, that classical Williamson-Hull equation can be modified, keeping the first factor same, but the second factor may be related to the anisotropic constant factor. Beta is there, but that beta is actually, it is not the beta is not that that earlier that we have considered the Fullerton half maxima, but beta is a factor which is known as a dislocation parameter. Okay, and in this dislocation parameter, we have that sigma, that dislocation density, and the Barger vector B. Okay, these are very important two parameters or important two factors that are there in beta, and beta is there in that particular modified Williamson-Hull method. So we need to know, we need to calculate the beta, but to calculate the beta, we need to know the dislocation density and the Barger vector. So what is the Barger vector? It is there already there in the literature, but Barger vector is considered along the line where along the particular line in the deformed and undeformed sector of the in the grains. In the zinc-branched FCC structure, we consider along that Barger vector is around value of that A/2 along 110 plane. I don't need to talk about that. Why do we consider 110 plane? Because we need to, then we just shift from our purpose, and so many things need to be explained. But we do consider the Barger vector as A/2 for zinc, or rather I can say FCC structure, but that HCP structure, that primary slip plane is 1/3, and the value of Barger vector is simply A, and that particular plane is again 1120, that for HCP structures. Okay, considering this Barger vectors direction, we may define different types of dislocation, such as edge, screw, and missed dislocation. Okay, corresponding to the whether the Barger vector is parallel, or corresponding whether the Barger vector is perpendicular, parallel, or in any arbitrary direction with respect to the dislocation line. Okay, so that edge and screw dislocations are basically the extreme form of possible dislocation that may be there in the sample. Now the contrast factor that we need to calculate, as I have told you, that C is there. We need to calculate the contrast factor, and to calculate the contrast factor, we have used this particular formula. It is there in the literature, and C bar 800 is the average contrast factor, and we need and Q, A1, A2, these are some parameters, the dislocation parameters, H square and H1 square. H square is also some parameter that is related to the FCC structure, and H1, H2 squares are also some parameters that are there in the hexagonal HCP structures. Now we before doing this calculation, we have to calculate the average contrast factor. This is a bit complicated, not that complicated, but some rigorous things are there. Okay, that there are some parameters like ABCT. These are constants related to the average contrast factors, and A1 is a parameter which is related to the elastic constant of the sample. The elastic constants and all these parameters are there available in the literature, or we can find it out. And considering all these elastic constants and these parameters, we may calculate that average contrast factors for screw dislocation or edge dislocation, as something like this, or these are there. These particular values are there in the literature for screw dislocation and edge dislocation, and we can calculate C bar H00 for this. Yes, this is for that dislocation parameter. Q is a dislocation parameter, obviously, but there are some theoretical values. These are available for pure edge and dislocation. It is there in the sample, or it is available in the literature, and we can avail these things actually. And the term H square, as these are related to the diffraction planes, these also can be calculated for different phases. I mean, for FCC as well as for HCP, hexagonal phase, and we can calculate these particular factors. Taking account into all these particular values, we may calculate the contrast factor. Okay, we may calculate the contrast factor, average contrast factor, H square and Q parameter. All these things we may obtain taking or collecting all these parameters from the literature. Okay. Now, if we do plot, what do we plot? We have to plot. Yes, I want to show you that. Yes, we need to plot then in the modified Williamson that delta K versus this C. Actually, we have calculated this C for different values. And if we do plot this value, then this is for piston sample, that delta K versus Kc half, because we have calculated the C for different particular planes, and this gives us that average particle size from the intercept can be obtained as 22.27, whereas from the slope the dislocation density can be calculated, because the slope gives us. Yes, I want to show you that the slope gives us the value of that beta actually, and in the beta we have the dislocation density and the Barger vectors are there. So from the if we get the slope from this particular plot, we may easily calculate the dislocation density from that beta value, and this dislocation density has been obtained as 1.10 into 10 to the power 14 per meter square. Okay, this is for piston sample, and if we do calculate for irradiated sample, we may get or we have got some increase in the average particle size even in the modified Williamson Hole method, and as well as we have seen some increase in the dislocation density as well. Okay, so that SHI radiation has an effect on the microstructural modification as well, whether it is related to strain or whether it is related to that dislocation density. So classical Williamson Hole method is actually giving us an idea that strain is increasing, and modified Williamson Hole method is giving us an idea, yes, that dislocation density is increasing in the sample actually. Now, in that particular that XRD, in the particular X-ray diffraction data or X-ray diffraction part of hexagonal, and let me show you. yes, this is for CdSe, and this is the irradiated sample for CdSe. Yes, this is the XRD pattern of the pristine or cubic structure of the CdSe, and this is the HCP structure of CdSe. And similarly, we have got for CdS also. So we did some read belt refinement in this 2 XRD pattern, and we have got a very good refinement in the case of that CdS and CdSe nanocrystals. You can go to that part. Yes, this is the read belt refinement for pristine CdSe nanocrystals, and this is a very good read belt refinement for irradiated CdSe, irradiated CdSe, and nickel irradiated CdSe. And from this refinement, we can obtain many structural parameters from this refinement. Actually, directly we may get many structural information, and this structural information are very important. Yes, there is a logic behind why do we have taken the, or why did we do the read belt refinement. Okay, so this is the read belt refinement for CdS. Earlier one was for CdSe, and this is for that CdS nanocrystal, irradiated CdS nanocrystals, and we have got some structural parameters out of this. That lattice parameter, volume, and all these things are there. Okay, as you can see that the chi-square value is very much near to the value of 1, so it is showing that the fitting is very good. Now what we have done, that collecting this structural information from after read belt refinement, we have just fed this or used these structural parameters for some theoretical analysis. Okay, using first principle method, where we have used PBE as the action correlation functions, and we did, here those who know well that here we did not did any we haven't done any sort of optimization, but whatever the structure that we have obtained from that XRD pattern, just simply we have used this stable structural parameters for theoretical analysis in the first principle study. Okay, and in the first principle study, we have obtained some band structures for pristine sample and for irradiated sample. Now I want to say here, I want to emphasize here is that this is not the pure theoretical analysis, because here we have connected the outcome of the experimental fact in the that is there in the XRD analysis. We have used the experimental fact in the theoretical analysis. There is a strong relation of experiment with the theory actually. So this is not the purely theoretical, but one sort of thing that I can say that here it is a relation between theory and experimental. So behind that theoretical analysis, the solid experimental fact is there, and we have found that the pristine sample has a band gap around 2.02 MeV, electron volt, and for irradiated sample we have some modification in the case of that CdSe and nanocrystalline sample, and there is some reduction in the band gap has been obtained after irradiation, and this reduction in band gap indicates some a good electrical conductivity, or rather I can say electrical conductivity may increase in this particular sample. Yes, that band gap we can obtain from absorption study, and we have obtained that, and in the experimental absorption spectral study we have obtained such sort of changes. Here I haven't included because of the time constant and the slide constraints. So what we did, that we simply did some theoretical analysis using that particular band structure process, and here again we did some density of states analysis, and this density of state analysis also shows the modification in the band gap actually after irradiation. And this is for CdS nanocrystals. Similarly, for CdS nanocrystals, we have seen some decrease in the band gap after doing some density of states and band gap analysis. Okay, what we did that in the case of that sample, CdSe sample, we have obtained the dielectric function, and yes, in the dielectric function, what we have seen that this is the proper dielectric function, and we have plotted this real dielectric function versus energy. And in this particular dielectric function, we have obtained the dielectric function for that CdS nanocrystals and as well as CdSe nanocrystals. Okay, so we have obtained some changes in the dielectric constant value at zero frequency, because zero frequency is related to the real dielectric constant, because this is the proper dielectric function. And at zero frequency, we have obtained that increase in the dielectric function from 5.06 to 6.52 value. So here we can see that it is there in the 5.06, and thereby after irradiation, the dielectric constant has been increased. Here we have found, and moreover, a slight shift has been observed in the first phase of the dielectric constant. This particular changes, and this indicates increase in the conductivity as well. Okay, so again in the case of refractive index, similarly we have found that that nickel and Ag irradiated CdSe, where dielectric constant has been obtained or increased from 2.61 to 2.96 and 3.01 for nickel and Ag irradiated sample. Now we did study those dielectric function and refractive index, because these are the parameters that are necessary for solar cell applications. Okay, and similarly we have seen some modification in the dielectric constant and refractive index value for CdS nanocrystals. Now, as I have told you that there is an aim to apply this nanocrystalline for solar cell material, I have used simply the CdS nanocrystals for solar cell material, whether that can be used or not. And here what we have studied, that silicon here has been considered as a p-type substrate or bottom subshell in heterojunction solar cell, and for our optical absorption material has been used as CdS actually. So again, I want to say that we did not have the facility for preparing solar cell and to characterize or to do all the study, but we did some simulation work using this PC 1D simulation software, which is also 3D available, and we have found that particular simulation giving us a good result, because the input parameters in this particular in this particular package is carrier mobility, band gap, dielectric constant, refractive index, and intrinsic carrier concentration. We have already obtained the dielectric constant and refractive index part in the case of pristine and irradiated sample. The carrier mobility that can be obtained from band gap, and resistance also can be obtained from band gap. Now, whenever we have plotted the current and power versus voltage, we have obtained a plot like this, and for CdS nanocrystals and for pristine CdS nanocrystals, as well as for nickel and Ag irradiated sample. And we have plotted the fill factor. That fill factor is a very important parameter in the case of solar cell, and efficiency as well. So yes, from this particular plot, we can obtain the open circuit voltage and short circuit current. From this particular plot, the short circuit current and the open circuit voltage that can be obtained, and after using this particular value that we can directly calculate the fill factor, and the fill factor has been found to increase more for AG irradiated sample. It is from 80.27 to 81.51, and the efficiency increases from 16.40 to 16.79. So that much percentage is very less, but this indicates that irradiation may increase the efficiency, or that the fill factor may increase after irradiation. So taking a suitable material, taking a suitable ion, this particular factor may be that may be increased further. In our next phase of study, we shall choose accordingly so that we can increase the fill factor and efficiency in a better way. So this gives us an indication that as the efficiency and fill factor increases, so this may be used further for better performance of a solar cell, because in the solar cell this fill factor and efficiency are very important. So efficiency we are getting as 16.79% as per literature. This is very well efficiency compared to all the available literatures are there in this particular research area. So if anyone is interested, then somebody may apply directly this particular result or this particular sample for solar cell application, because we have used a simulation project here to show whether this can be effective or not. But this is not purely theoretical, as I want to emphasize here, that we have considered the ionization effect, we have considered the dielectric, the microstructural modification, we have considered the X-ray diffraction study. All these experimental results are there behind this simulation, behind this, behind the dielectric constant and refractive index parameters. All these are there, band gap as well. So behind this particular result, proper experimental part is there. So this is very logical that this may be obtained if somebody can properly proceed towards experimental process in this particular case. Now, let me go to the next application part, which is thermoelectric properties and its application. So we know very well that clean energy source is very much urgent requirement in the energy field, as recently we have seen that fossil fuel are declining and price is very increasing. So huge amount of energy is getting wasted in the form of heat energy during the process of fossil fuel, with a significant amount of pollution in the environment. So very alternative part is the application of thermoelectric material, which directly convert the wasted heat energy to electric energy that may convert the wasted heat energy to electric energy, but for that we need some proper sample, and that may be done through environment friendly method in a relatively costly, relatively low cost way. So development of novel thermoelectric materials has got recently much interest, because this is the urgent requirement. But in this particular thermoelectric materials, the power generation is very important, and in that case, power factor is the most important parameter that play the role behind the efficiency of thermoelectric material, because in most of the case, what happens that we find in such materials it has very low efficiency, and if it is a low efficiency, it becomes very ineffective for practical application of power generation material. So we have this power, that this thermoelectric, again, just like solar cell, that the thermoelectric properties are very sensitive to towards the structural properties, and we did study some structural properties to the CdS and CdSe nanocrystals, and we have found that the structural properties then get increased or enhanced by irradiation effect, and we have seen that that irradiation may increase or modify the samples. So here simply we have used CdS nanocrystal for the power generation application, considering the first principle method or dislocation density functional theory. And in this particular part, we have used the bold step package for the study of the transport properties in the quantum espresso package, and this related to semi-classical Boltzmann transport theory. Okay, this is the pristine sample. This is the pristine sample arrangement, that FCC structure, and this is the SCP structures. And in the thermoelectric properties part, Seebeck coefficient is very important, right? So we have plotted using that particular package. We have obtained the Seebeck coefficient for different temperature, and we have plotted that particular Seebeck coefficient for the pristine and SHI irradiated sample. And we have found that for SHI irradiated sample, which modifies the microstructural factors, we have found that Seebeck coefficient decreases from 819 to 524. This decrease in the Seebeck coefficient directly indicates that there must be improvement in the carrier concentration. Okay, because this high Seebeck coefficient is less carrier concentration. That Seebeck coefficient is less means the carrier concentration. There is improvement in the carrier concentration. The Seebeck coefficient is an important parameter in the case of that particular thermoelectric material properties. And again, we did obtain the electrical conductivity. Here we have found that electrical conductivity has been increased significantly at room temperature. Okay, here also I want to say that we have obtained the Seebeck coefficient at room temperature, because we need to get the particular factor at room temperature, because we need to apply the material at room temperature for power generation. Okay, so here we have obtained a little bit of increase in the electrical conductivity. So that carrier concentration increases because of the decrease in Seebeck coefficient, and as well the electrical conductivity also increases. Okay, and thereafter we have found that thermal conductivity also has been found to increase a little bit. So all this part, that enhancement in the electrical conductivity actually leads to the electronic part of thermal conductivity as per Weidmann-Franch law, because this Weidmann-Franch law already described that electrical conductivity may lead to the increase in the thermal conductivity. So here we have obtained the thermal conductivity increases for SHI irradiated sample, and electrical conductivity also increases for the sample, but Seebeck coefficient decreases, which indicates that carrier concentration decreases much. So all these factors are very effective in calculating the power factor, because power factor is nothing but S square sigma. The S square is the Seebeck coefficient, and sigma is the conductivity. Okay, so that after calculation, taking all these parameters into consideration at room temperature, we have found that power factor has been increased from 16 to 140. There is a drastic change in the power factor after SHI irradiation on CdS nanocrystals. Okay, so this is the power factor. You can see we have plotted this power factor, and at the room temperature we have obtained a huge increase in the power factor value in the case of SHI irradiation sample. So this improvement in the power factor is directly related to the power generation application. So there's such improvement in the CdS nanocrystals due to the SHI irradiation obviously gives us an indication about the fact that the CdS nanocrystals, the SHI related CdS nanocrystals may be applied as a thermoelectric material for power generation or power conversion, okay, from heat to electric power. So this is the things that we have studied for CdS nanocrystals. We still yet to do on CdSe. We shall check it, but this particular paper just recently been communicated, and we still need to get the reviewer report and hope that it may be effective in the future research area also. So in the overall conclusion, what we can say that CdSe and CdS nanocrystals where that irradiation effect produces some or modifies the structural parameters which we have obtained from XRD analysis, and all these microstructural parameter, increasing microstructural parameters are related to the that different factors like refractive index, dielectric constants, which are related to solar cell application, and we have taken that structural data after Rydberg refinement, and this structural data has been fed into the quantum espresso code for obtaining optical and electronic properties, and thereafter using the PC1D simulation, we have found that CdS may be a very effective solar cell, can act as an effective solar cell device, because we have found a large increase in the efficiency of the sample. And similarly, the CdS nanocrystals also has been found to can be applied as a power generation material. Okay, so in future we can do study on CdS nanocrystals, and we shall do some correlation between SHI induced microstructural modification with different transport properties like carrier concentration, mobility of the semiconductor nanoparticles, etc. And further also we shall try to do some effect of SHI radiation on chemical disorder and periodicity of atomic arrangement. Okay, these are some references, and with this I want to finish these things up. Hope I have finished it before time.
Thank you, sir. So it was a very informative lecture. So participants are requested to put their questions into the chat box. So, sir, can you see the chat box, or shall I read it for you? Dr. Dash, you are muted.
Oh, sorry. I am absolutely sorry. Sorry.
It's okay.
Yeah.
Sir.
So Dr. Swati Mehra, she has asked for a that whether there is any good book. Yes, I want to show you. You can write these things. Yes, there is a book I have given here somewhere. Let me show you. You can note down this word. Somewhere I have written it. Let me see whether it is there or not. Yeah, elements of X-ray diffraction by BD QDT. You can get it almost all the X-ray diffraction related facts are there. So you can get all the information in that particular book. This is a very great book related to X-ray diffraction. Okay, any other question? In the chat box, I don't see any question.
Yes, sir. There is a question. Let me read it, sir. While increasing metal ion concentration on the host material, the micro strain increases and particle size decreases. What is the reason behind?
See, sometimes what happens that the particle size may increase, particle size may decrease. Okay, depending on the materials, on the ions that we have, we can choose. So what happens that suppose if you send some ion towards that particular a particular sample, that what happens that the grain size may get modified. So in the case of ACP, you can see that dislocation density may increase. So thereby, what happens that the grain size may decrease this way. Therefore, we may obtain a smaller or the size may get decreased, but the strain may increase a little bit.
So I guess Dr. Umar have understood the answer. So if anyone else have any more question, you can directly unmute yourself and ask to the sir. Still there are some time, so we can go with that.
I think all the participants have got exhausted after attending all these long sessions. They are taking their time actually. Okay, if there is no question, then I think we have to wind it up.
Yeah. Okay, then participants, if you have any further query, you can directly mail to Dr. Dash. His mail ID and contact details will be available in the Tripura University website. So if any more question is not there, then we'll wind up the session.
Okay, thank you.
Okay, sir. Okay, sir. Thank you, sir. So participants are requested to come back for the last session of the day as well as of the faculty development program on the progress on 2D materials. So it will be start at 2:30 p.m. So please join by 2:15, 15 minutes earlier from the session. So thank you. You can have your lunch now.